We're going to talk about ADHD medication this week. There's a video, it's just about an hour long, but it's cut into segments. It's a documentary about individual children and their story about taking ADHD medication. You don't have to watch the whole thing. It's very interesting, but you could pick a segment to understand the nature of one child's interaction with ADHD medication. So ADHD, I'm sure you've learned in your other classes, it affects about 5% of all children. As they mature into adulthood, there is a reduction in restlessness and hyperactivity, but the main symptoms of ADHD remain, so impulsivity, impaired attention, lack of intrinsic motivation, so the internal drive to do things. But about 40% completely outgrow. So they're not really sure what happens, that some people don't and some people do, but they wonder if it's the maturing of the frontal lobe, prefrontal lobe, which is the part of the brain that is your executive function. It's kind of the part that makes us human, and then we grow into it as adults. So some diagnosing issues. So because of the symptoms of ADHD, it overlaps with many different syndromes, which are some of them are listed here. So it can be very difficult to diagnose at times, and therefore it makes it challenging to decide to use a medication or not. So some ways to diagnose: needing a detailed family history, so parents, grandparents, aunts, uncles, cousins, because ADHD is genetic. Looking at the detailed history and nature of the onset of behavioral symptoms. So when did it start? Did it start when they were a little baby? Did it start not until they got to school? Was there disruption in their home life? Was there divorce? Did they move? What else was happening at the time? And then description of current symptoms. So does it change from one setting to another? So are they different at school? Are they different at home? Are they different at daycare? So looking at varying places. So some symptoms, so looking at very early on, so in infancy, so a child who's diagnosed with ADHD, it can be seen in as early as very little, looking at restlessness, unstable sleep pattern, affective lability, so their moods change quite quickly and hard to soothe. Preschool, so it's usually identified when they're in preschool, so when they're 3-4 years old. Some symptoms, so once they get to childhood, so more 5 years old plus, you're seeing things like hyperactivity, impulsivity, impaired self-control, so impulsivity essentially, difficulty staying on task, so being focused, and limited intrinsic motivation to stay focused, so they don't have the drive to finish the story they're reading, for example. So symptoms are more noticeable when the child needs to sit still and be quiet. So obviously in a school setting, it's much more noticeable than when they would be with their friends and running around in the playground. So once they get to adolescence, so the hyperactivity usually is reduced, but it comes out in different ways. For example, being very disorganized, having a hard time keeping their binders organized, having a hard time remembering what to bring to each class. And they have increased problems with societal and school-related demands, so getting things organized, getting things handed in on time. And substance use, as I'm sure you know, is much higher, especially when the youth aren't treated for the ADHD. So there is an inattentive type of the disorder, so it's unrelated to ADHD, so it's more ADD. So it's impaired attention, but they're not hyperactive or impulsive, so it's just hard to focus. Stimulants don't work for children that are diagnosed with this, but they also haven't found anything else to help treat it. ADHD in the brain. So what parts of the brain can you tell? So when you're actually looking at the structures of the brain, there are size differences, so in specific parts of the brain, and it's looking at impaired frontal lobe functioning. So those are the parts that are judgment, you're thinking things through, cause and effect, that kind of stuff. Also noticing abnormalities in the dopamine system. And the size of the structure, so the smaller it is, the more impairment there is, and the worse the ADHD symptoms appear. So there's 3 types of medications that can be prescribed to somebody with ADHD. So stimulant medication, certain antidepressants, and alpha-2 adrenergic agonists, sorry about that. So stimulants, these are the ones that we know the most that work the best for ADHD. So it inhibits dopamine reuptake, so it's slowing it down, it's keeping it more in the brain, so it's being more effective. Amphetamines, so it is a stimulant, promote increased release of dopamine. So medication usually starts to work within an hour and lasts between 4 and 12 depending on the type of medication. Some are extended release, some are quick release depending on the type. So therefore some need to be taken multiple times a day, and so kids would have to take it more than once while they're at school. So there's two types of stimulants. Like I said, there was an immediate release, so they last only about 3 to 6 hours. So these types of medications would have to be taken again when they're at school. And then there's sustained release, so these ones last a lot longer, so they would go the whole school day, and they wouldn't have to be taken again during the school day. So some guidelines. So when a doctor starts a medication, they would start with a low dose and then carefully increase it to the point where the symptoms are reduced. So they would start with 3 times a day to spread it out, and then they would taper it down to once or twice a day, always looking for side effects and close follow-up. So they would have a few doctor's appointments to get to make sure the medication is at the appropriate dose. So usually start the medication on the weekend so the parents can monitor how it's working, and also because the medication can wear before the child gets home from school. A medication rebound, that's where the drug has completely gone from the system, so this would be probably a fast-acting medication, and there can be an increase in symptoms. So once the medication's out of the system, there can be a rebound in how many symptoms are showing, so the kid could be extra hyper. And these kind of medications should be taken every day, even on weekends. So taking drug holidays on the weekends is not suggested to be a good plan. So as we know, ADHD can also have impacts on social interactions, so getting along with their peers. So it can affect their self-esteem, their peer acceptance of how they get along with everybody. And stimulants are considered to be the safest and have the mildest side effects of all psychiatric drugs. So actually they are safest to use with children. Even though there are a considerable amount of side effects, and these are the most common ones, but can also be mitigated by other interventions. So insomnia, it should be taken early so it doesn't affect sleep. Appetite can be reduced, so they have a hard time feeling like they need to eat. Stomach aches can be, but if you give it with food, it can help. Mild dysphoria, so it could be, they can make them a little sad. So either change the medication, or you could add in an antidepressant medication, but again, that's adding in more medication than the child maybe needs. Lethargy, so if they're really dopey and sleepy and lazy feeling, then the dose is too high, so they can just reduce it. And headaches, so either reduce the dose because it's too much, or change completely to a different medication. Other side effects, so ADHD and tics, so either verbal tics or physical tics, so kind of a twitch. The stimulants can make tics worse, so it's being careful. So you can add a different kind of medication to help with that. ADHD and anxiety, so stimulant medication can make anxiety worse, which makes sense. So usually the anxiety is related to the social or academic failure, so trying the stimulant medication first, so help improve their ability to focus on tasks and tests and handing things in, so that way they feel more accomplished and their anxiety likely would go down because they're feeling better being at school. So anxiety will be better if the ADHD is treated. You can also add an anti-anxiety medication on top of an ADHD stimulant. So substance use, we talk about this a lot, that untreated ADHD has a significantly higher substance use risk. So actually medicating ADHD can actually reduce the risk of substance abuse later on. So the positive effect of stimulants wear off in late afternoon. You can add another medication. So if it's a quick release, sometimes children have a dose after they get home from school to kind of get them through. So homework time, dinner time, and then before bed they don't have anything because having a stimulant medication can interfere with their sleep. Other side effects, so consequences of misdiagnosing and subsequent stimulant treatment. So if you give a stimulant medication to a child that actually doesn't have ADHD, there could be other problems. So if the child actually has something called an agitated depression, so they have a low mood, but they're irritable, they're antsy, they can't sit still, it can actually increase their agitation if you give them a stimulant medication. If their symptoms are more related to a schizophrenia type illness, so if their inability to focus is because of, for example, they're having hallucinations and it looks like they have ADHD because they're not focusing at school, and then you give them a stimulant medication, it can actually increase the psychosis. Same with bipolar. If they're it can throw them into a cycling, so it can go if they're looking like they can't focus, it could actually throw them into a manic episode. If it's a situational stress, so I mentioned earlier, if, for example, something is happening at home or school that's causing them to be stressed and having a hard time focusing, then it could actually just, you're not actually addressing the problem. So if they're stressed because the family moved to a new town, or their parents are getting divorced, or they're being bullied, and you give them medication because it looks like they can't focus, then you're actually not actually addressing the problem. So taking a really good history as to what's going on and asking more information about what's happening in the child's life. So the next type of medication, so these are examples. Clonidine is an example. They're most effective in reducing irritability, aggression, and impulsivity. It can promote sedation, so if there's some insomnia, so inability to sleep, this can actually help, and it can help to treat tics. These medications you rarely hear being used with children, in this area at least, but they are possibilities. Antidepressants can also be used to treat ADHD, at least some of them, and a lot of children who have ADHD have co-occurring depression, so they're also depressed at the same time. But not all antidepressants should be used for ADHD. So, for example, things like Wellbutrin and Strattera are ones that can work because they affect both dopamine and norepinephrine. So medication combined with treatment, so meaning medication but also either counseling or behavior intervention at school or a plan at school, whatever it happens to be, whatever the treatment is. Medication alone was effective in treating ADHD, but the ideal is having both. You should have both medication and therapy to help with ADHD. And especially if there's a co-occurring anxiety and depression with ADHD, having some counseling around the anxiety and the depression can help considerably.